My name's JoAnn Long, and I'm a professor of nursing. I teach in all 3 levels, but spend most of my time working with students at the graduate level. I oversee our research partnership with the hospital, and one of the biggest joys of my life is working with our alumni in development, and I thank you to the board members that are here, so thank you for being here and supporting today. And with that in mind, I'm going to let the rest of our team, we have a small team that's working together on this project, introduce themselves.
I'm Randall Stennett, and I am a simulation coordinator at Covenant School of Nursing. And I think I got roped into this team, I'm not sure why. Oh, I know why now. Because of my learned experience. I have a DNP. And so if you kind of look at the title of our presentation, we're going to talk about statistics and the DNP program, and I lived through statistics, so just so you know, that's kind of where I come from with this presentation.
Most of you know me now. I'm Vanessa Bolyard. I am an associate professor here. I teach in the DNP and FNP programs. And what drew me into this project is just there is such a, and we're going to go over a lot of this, there's just such a wide variance of knowledge and application when it comes to DNP projects, when it comes to the statistical aspects of these projects. And so I was very intrigued to work on this project so we can maybe dig a little deeper, maybe find some answers, and maybe come up with some solutions.
Hi everyone, my name is Emilia Garcia, and I am super excited to be here to share our project with you all. Currently I am the neonatal program manager at Covenant Children's in the NICU, and I also co-chair our clinical inquiry council. I am super proud of our team, and even more proud that I get the opportunity to work with them. The biggest reason that I was drawn to this project is because I wanted to learn more, and we learn all the time. And these amazing, talented, intelligent friends and colleagues, I mean, there's no one better to learn from and learn with. And so with that, I say that specifically because kudos to you all who are in this DNP program, because that's exactly what y'all are doing. And that's what we should continue to do every day as we work in our selected healthcare fields. So with that, I think we're ready to get started. Do we use this? Oh, okay. Oh, thank you. Oh, okay. Okay. So as you can see, the title of our project is Theoretically Guided Strategies for Teaching Quantitative Methods for DNP Scholarship. And this particular project began for a desire for some direction in how we teach or how quantitative methods are taught to the DNP student. And our team certainly doesn't have all of the answers, so we provide this as a suggestion, and after going through an IRR, it's probably a little bit more than a suggestion, but we want to implement a theory, and you thought that you would never have to do theory, nursing theory again, right? But it's always around us, but it's super, super incredibly helpful and incredibly important. So I'll start with a little more background on this topic. As you all probably know, DNP projects programs continue to grow. Like more and more colleges are implementing DNP programs, and praise God that we now have one at LCU. And as DNP scholars, we are charged with or becoming those leaders who can affect change at the bedside and lead multidisciplinary teams to impact patient outcomes and data metrics. There are foundational competencies required for DNP programs. Does anyone know what those are called for the DNP program? The foundation principles for a DNP program. Well, they're referred to as the DNP essentials. Raise of hand, how many of you have heard of those, know of those? Anybody? Awesome. So, of those few of you who have, can anyone tell me how many essentials there are? How many DNP essentials there are? Yes, ma'am. Close. 8. There are 8. And so for this particular project, we're going to be focusing on DNP essential number 3. That particular essential is called Clinical Scholarship and Analytical Methods for EBP. So the learning outcomes for this particular project will be the discussion of our integrative research review, and we will share with you our proposition for a theoretical model for guiding the development of clinical scholarship in the DNP student. So why in the world would we do something like that? Why did we conduct this integrative research review? In doing our research, evidence suggests that we need to, as clinical scholars, increase and improve the rigor of DNP projects. DNP students, I have a question for y'all. I mean, are y'all already thinking about, I don't know what my project is going to be. What can it be? And you have all these things going on in your brain, right? Have any of you happened to get online and Google DNP projects and see them and kind of skim through them and read them? Have you noticed that there are some differences? Some are just like the rigor in them is like fantastic. And there are some that are not. Have you noticed that? If not, I would ask you to do that so you can see the differences. And this is why we decided to dive a little bit deeper into this particular question about how quantitative methods are implemented into a DNP project. And if you would look at the very last point on here, this is the point that really led us to conduct the IRR. So I have another question for y'all. What do we mean by quantitative methods? Does anyone want to take a stab at what you think that means and what we're talking about? Anybody? Just take a guess. Where are the DNP students specifically? Here?
We're all here to learn.
Yeah, for sure. That's what I did with this team was I was here to learn.
I think that the basic, because I'm here with my, I was telling her,
Hey.
I said, so basically quantitative is measurable, and like when you have qualitative, that's where like your feelings, how that makes you feel, and that's so measurable. So just to like make it, I feel like it's simple.
Yeah, absolutely. That's exactly what it is. Anyone else? Did you say Stacy? Yes, ma'am.
Is it more so to provide value to these competencies instead of maybe if you have a new hire who's saying, I want to build this, I feel like we have data to pull from maybe newly hired students?
Yeah, absolutely. Absolutely. So the methods refer to the techniques around data collection. And then because there's all different ways to collect data, you can have surveys, on paper. You can talk to someone and have surveys. You can have data through Excel and all the numbers. So there's all sorts of ways to collect and to find data and produce data. But then when you have that data, what do you do with it? Then you have to analyze it. And so then I think that's when our brains go, oh my gosh, I don't know how to do that. I'm not a statistician. But you can do that, and you'll learn how to do that because there are specific methods that align with different projects, and that's what's really cool about being in a doctoral program is you'll get to learn what methods align with your particular type of project. So what we did, and what I understand that you all are going to do, and I know if any of y'all were in the master's program here at LCU, have already done an integrative research review. So you all will get to do that. And that's something that we do. That's not something that is just being taught here at LCU or at other programs. That's something that we as scholars do on a regular basis. An integrative review helps you get to the answer to your question in a way that's systematic and you can reproduce it, so it's reproducible. So it's something that you're just not willy-nilly doing, and when you're sharing that information later and disseminating at conferences or in your own units or hospitals or nursing organizations, you can share that information and it will be completely reproducible, and it has more merit that way. So much so that you can publish those results as well. So what we did is we worked with a research librarian. So tip number 1, know your librarian, work with your librarian, be kind to your librarian, because man, just like I said earlier, I wanted to learn from other smarter people. That's what you do, and they are the experts, and they can show you, guide you, and help you with a literature table, with mesh words, your keywords. Those things make a big difference, and they will help you narrow down some of the confusion, because sometimes, like I said, when we were talking about different projects that you might do, sometimes I think keywords run crazy in our minds the same way as well. So get to know and love and support, and always encourage your librarians because they're amazing. As I'm going to go specifically verbatim what our mesh keywords were: teaching strategies, or learning methods, and quantitative methods, and evidence-based quality improvement, or evaluation project, and DNP, or doctorate of nursing practice students. So those terms, those ands and ors, make a difference. So this is why I suggest that you reach out to your librarian, because they are super helpful with those types of phrases and searches. So at a minimum, what we knew that we wanted our articles to have for inclusion is that they had a descriptive metric of the way the project was designed. So that was number 1 inclusion that we knew for sure the article had to have. And then some of the things that we excluded were opinion articles, and then there were a lot of articles that may have had some of that information, but they didn't share any measurable outcomes with us, so those were excluded as well. And then, once you do your literature search, what's really cool is that there's all these tools and guides and resources that help you streamline everything. And for me, you can probably tell how my brain works, because I do see a lot of times the jumble of all the ideas and thoughts and questions. But when I have a tool to help streamline things, man, it really brings me a lot of relief. My stress level comes down. And so I want you to take these tools as that, because they really are there to help you, not to add extra work. So you'll be using a Prisma flowchart diagram. And so basically what this does, it just gives an overall, a visual overview of what we did systematically. So we had our MESH key terms, we did our literature review, we logged all of that into a literature table. So we had name of the author, the article, the title, all of those things. And again, what was great to work with a team is you might find 30 articles or 60 articles, and if you're working with a team, then you can distribute those and everybody can take part in reading them and synthesizing them. When you're working on your own, it's a little bit different, and I get that. And but the work in the end, all of that work is totally worth it. What we ended up finding were, initially we had 10 articles that we found. Of those 10, we excluded 6. For example, one article talked about telehealth, so we excluded that one. And another article dealt with developing a form of synthesis, and so we weren't looking for that, so we excluded that one. So we ended up excluding 6. That left us with a total of 4. I think maybe a better wording of this at the beginning, it says new studies included. I think if you just drop the word new, and it should better read, studies included in review. That N was 4. But then through bibliographic mining, we were able to find 3 more. Anybody know what that is? Bibliographic mining. I can barely say it. Yeah, super cool. Because then you can look and, oh, this one, we didn't see this one. So by doing that, we found 3 more. So that left us with a total of 7 articles. So you see that at the very, very top right, where it says citation searching, and that N is 3, and then it comes down. So then we have our original 4, and then we added the 3 for a total of 7 articles. Was that pretty clear? Okay, awesome. I'm gonna now turn this over to Dr. Bolyard.
Okay. I'm going to go through our literature review table. So when you guys come up with your question, you start diving into literature, and then you start sifting through everything, and then you come up with your final number. You're going to have to, you have to do something with that final number, correct? Okay. So you're going to end up creating some sort of a matrix or a literature review table, okay? And what this does is organize, basically it helps organize all your thoughts, okay? So I'm going to go through the final articles that we found. Donovan here, this was the focus of this study was just to determine if DNP student projects were of the quality and rigor at the doctorate level. When overall what they found was that, and this used the Squire guidelines. Dr. Garcia mentioned that you're going to be using appraisal tools. There's a variety of appraisal tools out there. You'll find that you're probably going to be leaning towards some more than others, but this the Squire guidelines was used for this. And what it was found that of all the projects that were analyzed, that they definitely saw weaknesses in all 16 components when it came to qualitative findings. And overall, they found there was need to improve the rigor of the DNP, FNP, QI scholarly projects. I forgot to mention these particular student projects were a DNP, FNP, BSN to DNP students. Kirkpatrick. What this was, it actually took dialogue. This was an invitational nurse summit conference that was held, and basically the idea behind this conference was just to have some dialogue, some discussions on just the types of DNP projects, rigor of these projects, structure of these projects. So what they did is they had 8 questions, and they met in small groups, and then they took those questions and answers, and they identified certain themes. And what they found was that there was just a lack of congruence among stakeholders, and that could be, stakeholders being your faculty, your students, whoever else. And especially when it came to analytics and statistical method requirements. So they were finding with these different projects that some projects really had a heavy focus in that, other projects did not. Some projects, the results indicated statistical quantitative results, but then it didn't really, in a sense, jive with what the whole setup of the project was, if that makes sense. Milner, this study looked at, it compared EBP and QI project elements in a variety of DNP projects or papers after the release of the AACN white paper. So the AACN white paper, this was actually published in 2015. And this was published after, and I don't know if you remember in the PowerPoints earlier today, the DNP programs have just exploded, right? And so they were initially designed for APRNs, and then they kind of have expanded. And then with this explosion, there was kind of a lack of structure. So the AACN, they submitted this white paper, and it went over specific requirements of what a DNP program should be, and most specifically what a DNP project should be. Okay, so this looked at studies or projects before the paper and then after. And the overall findings showed that there was a positive note in 19 of the 27 roadmap elements assessed. However, no project contained all 27 of the recommendations when it came to this roadmap. And recommendations stress the need to help students understand, visualize, and use data to describe and solve clinical issues. Okay, Dr. Garcia mentioned, or with y'all's discussion, what's the difference between qualitative, quantitative, and what's the value in these things. And so this study did show that we weren't displaying this to the full potential that it could be. Turkskin looked at the methodology, rigor, and scholarship of DNP projects at Johns Hopkins University over a set time period. And what they found is that there was a wide range of I can't say that word? Methods. Okay, sorry. It's been a long day. And they didn't specify a conceptual framework. Again, that there was just a wide range as far as, the setup of these projects, and that there really wasn't much rigor in these projects. It wasn't standard across the board, and that really was recommended for those. The vet, they looked at looked at different educational strategies used in master's and doctoral nursing education and in a set time period between 2011 and 2021. They reviewed 56 studies, and they noted that 158 educational strategies were identified. Most studies focused on learning outcomes of satisfaction or knowledge, but didn't really look at the evaluation of the particular educational strategies that were used. So they really did focus a lot on just, again, students' perception, maybe experience, but didn't look at the actual structure of educational programs. Let's skip ahead here. Waldrop, this looked at understanding how DNP programs pulled in the essentials of a doctoral nursing education. And I know we focused a lot on QSIN earlier this morning. So DNP essentials, that came out with the AACN, and that was somewhat absorbed with our advanced practice essentials with that there was a change somewhat in 2021, and then QSIN is a different competency. So I just want you guys to kind of understand that we are following QSIN, which is somewhat of a subset of AACN, okay? And the last, right, this looked to identify and discuss project core processes, challenge, and solutions. And overall, there's a need to just improve the standardization of guidelines for DNP projects, to the structure of DNP projects, the rigor of DNP projects, and also It looked at communication problems between students and faculty because, again, a lot of structures were different, a lot of projects were different, and just it really kind of validated the need to have guidelines as structure across all programs and projects as well. Okay, so overall, what we found, there was really a limited evidence on how to teach research and quantitative competencies to DNP students. And that is across the board. That's usually one of the things that most students are a little bit nervous about. When you think about a DNP project, you talk about quantitative structure, then everyone can get a little nervous, but we have some excellent instructors on that, for sure. There was numerous problems related to quantitative competency emerging in DNP project analysis. As you can see these examples here, a small percentage of the projects relied on a single statistical method. Really, it didn't justify the tools that were being used when you look at quantitative results. Some projects, they found serious flaws in both methods and evaluation. There was also found to be significant errors in data analysis. Okay, we can't just use a t-test, and call it good. That has to be justified when you actually look at your structure and what you're trying to measure. There's a lot more that goes into that. We identified that there was 5 categories of needs, and I'll just go ahead and read these word for word. Need for competency-based and or project-based teaching learning methods. Need for methodology consistency. Need for increased clarity in DNP project deliverables in alignment with national standards. Need for evidence-based approaches to teaching quantitative competencies and skills acquisition. And need for differentiation between quality improvement, EBP, and implementation science project methodology and metrics. And overall, there was no studies that reported applying a theoretical framework. You see examples of conceptual models, okay, our plan, do, study, act. Those are used a lot in projects, but you don't see as much of application of a conceptual and a theoretical model. Does anybody know the difference between a conceptual model and a theoretical model? Why does it matter? Nobody cares at this time of day? Okay, I get it. So your conceptual model is looking at more just process flows, and it looks at how things maybe can be linked together. But your theoretical model is going to show you more the why. Okay, why are these relationships how they are? Okay, why is this happening? So really, it's essential to have a theoretical model approach when you're looking at projects and teachings and DNP programs. Does that make somewhat sense? Okay. Is this yours or mine? Okay, I'll turn it over.
So if you go back to that first slide, we were looking for some guidance. We didn't get any guidance. So how many of you love statistics? Ooh, there's a stats person. That's good. That's good. Keep that one in mind. So some of us struggle with statistics. It's a hard subject. Not just the formulas that go with it, but the application of those formulas and analysis of that after you get through is all part of that, and it's a challenge. And as we got into this, I was talking with Dr. Long. I said, if we're looking at a theory, I think I have one that might fit this just real well, and cognitive load theory is the theory that we went with, and I have, in the last few years, fallen in love with cognitive load because I think it explains a lot about what we do in education to try to help you to learn. And so we're going to try to give you an overview of 30 years of cognitive load theory in just a few minutes. So here we go. Cognitive load theory explains to us how we get things from here into our memory and how it stays there, and then how our brains can recall that from our memory to work on problems that we are encountering. Scaffolding is a big word in cognitive load theory, and we scaffold. If you think about as you were growing up, you didn't learn to multiply first, did you? What was the first thing you learned to do? You learned to add and subtract, right? And then you scaffolded off of that, from that concept to division and multiplication. So you scaffolded and learned. The same goes with anything that we want to learn. We have to scaffold off our previous experiences. So in cognitive load, there are two types of memory. There's long-term memory. The beautiful thing about our long-term memories in our brains is it's unlimited. You get the biggest warehouse ever in your brain. Long-term memory. Your long-term memory is where we learn to perceive about things, where we think about things, where we make those decisions and problem solve. It's how that happens is our long-term memory. Our working memory is very limited. You're using your working memory right now as we talk about this presentation. In your working memory, you can handle 5 to 9 pieces of information at a time, and that's it. So if I overload you with more than 9, some of us had trouble with 5. So we have to take that into consideration as well. If I overload you, your learning process stops. Does that make sense to you? So if I overload you, you have problems that may be my fault and not yours as an educator. So there are 3 types of cognitive load that we talk about in this theory as well. We talk about intrinsic. Intrinsic cognitive load is, there are some subjects that are just hard. So they have a high intrinsic load to those. Some subjects are hard to others and not to, for statistics, it's not an easy one for me. So I have a high intrinsic load from statistics. But that's the level of complexity that is inherent in that topic. Extrinsic is imposed or is not relative to the learning process. So if the temperature in this room was 80 degrees, would you be comfortable in this room? Would you be listening to what I'm saying about cognitive load theory, or would you be looking to get to the door so you could cool off? So those extrinsic things, I can have an impact on those. If it was freezing cold in here, it's the same difference. That is a load on your brain because it's in working memory. Man, it's hot in this room. That's one of those pieces of information I just took away from you that you could be using to learn. I hope that makes sense. That's the way I understand extrinsic. Germane, those are the things that we want to happen in this exchange of information so that you can learn. That's like those processes that give you the aha moment where you get it. Those are the germane things that we want to look at. So those 3 types of memory, this is what we do with cognitive load. This is what we're trying to do. We want to control how we deliver our instructions to you. And the way we do that is we manage the intrinsic load, which is the difficulty of the subject. We minimize the extraneous, so I want to make sure the temperature is right in here. If the person next to you is thumping their leg like this and it's driving you crazy, that's an extraneous load for you. You're not listening to everything I'm saying. One of those little pieces of information is gone. So we diminished your learning capacity. And then we want to maximize those aha moments. How do we get you to those aha moments? So that's a nutshell of cognitive load. So, like I say, this is a 30-year theory. It's been studied like crazy. We continue to learn things about it, but it makes sense to me that if I can decrease some of these things that are floating around in the room, you're probably going to learn better. So Some of the strategies that we can use with cognitive load theory that can help us with learning is to tailor the lessons according to your existing knowledge. I need to know where you are as far as, if we're talking about statistics, what's your background in statistics? I mean, what classes have you had before? Did you struggle with those in your master's level? Did you struggle with them in your bachelor's program? Those are the things I need to know as an educator so that I can help to tailor what we do to your knowledge and skill level. Scaffolding, where's your skill level? How do I get you to the next level? Worked examples. I am currently taking a data analysis class. I sure wish they were doing more of this for me. Worked examples work for me. Worked examples help you to work through a problem so you see what happens at the end. The more you do that, the better the process gets. So I wish that were happening in this class. Omit non-essential information. You could care less what my dog's name is today, right? So if I brought in the topic of my little dog at home, is that extraneous to you? You don't care about my dog. The stories about my little, you might care about my little dog. Oh, okay. But do you see what I'm saying? We can limit those extraneous. As instructors, at least in nursing anyway, we love to tell our war stories. You know, back in the day, you know, some of those will work, some of them don't work. Some of them are extraneous. So we have to think about that as instructors. Present all the essential information together. If we're working on a specific problem, I want to give you the steps to that problem and how it works out all together. Then let's break it down into pieces and go through the steps of that. And that brings us to the next one, is to simplify those complex things by presenting it both orally, visually, recordings, auditory. The more senses that we can involve in that learning process, the more likely it is to stick in your long-term memory. So that was cognitive load in 30 years and 5 minutes, I guess.
Well, stay right here. Don't go anywhere yet. Because Dr. Stennett represented our team and our abstract and poster was accepted for presentation along with some others in this room at our Sigma Theta Tau International Research Congress. And he presented this information there. And I wanted to say, as we look at this, just in summary, don't go anywhere, what our study has shown us, what our IRR has shown us is what our hunch was, and that was there's limited information on this, and we don't have consensus on how to teach it well. But we do know that the application of theory or theoretically guided strategies are more likely to be effective than non-theoretically guided strategies. And we have a huge amount of knowledge about cognitive load theory. It's a framework that's been used worldwide. And if we can apply elements of cognitive load to how we teach you quantitative methods, you're more likely to be successful. And that's really what we have learned from this. And I wanted to ask Dr. Stennett, he had quite a bit of audience feedback and participation. Why don't you tell them about what some of the people in the audience had to say to you after you gave this?
Just a little background. My presentation was on Sunday morning at 9 o'clock. The conference ended at noon. So I was more than greatly encouraged by the number of people that were there for the presentation. As I presented, I kept getting lots of nods over here from one of the participants. And then I had a gentleman over here who just sat and very stoically listened the whole time. When I got through, this group over here with the nodder were agreeing with everything I said. We really don't know how to teach statistics consistently. And so everything that I told them was something that those that taught statistics knew already. But I think what we did was put on paper that it needs to be worked on for sure. And how do we do that? No one has done a theory-based application. So I think we're in a good place right now, and I think moving forward, I think we'll do even better. The gentleman over here who just kind of sat, waited to catch me out in the hallway. So, you know, hallway meetings are the most important meetings anyway, right? But he is not a nurse, but he teaches statistics at a nursing school. His wife's the dean, so I don't know how that works. But and he said, I have struggled for years with how to get this to the nursing students in an understandable way. He says, I love the numbers. It's that challenge of getting it to the students. And I think everyone that teaches this subject probably struggles with that in more than one way, I would probably say, because of the diversity of our student population as well. So I think we're in the right spot, and I think this is not the last of this. I think it needs to move forward.
Thank you. Really appreciate that, Dr. Stennett. Well, my job is just to wrap it up, and this is on the fly, but I think I'll just quiz you, if that's okay. So you remember, what was extrinsic in cognitive load? Just anybody. Extrinsic is what? Relates to what? External, right, and how complex it is, right? And intrinsic, was that, did I get that? No, extrinsic is on the outside. Intrinsic, I'm sorry, misspoke, is how complex it is, right? And extrinsic. And then germane was what? What we want to maximize. Okay. So here are some things that I've already changed. Those of you that are going to have the class in the spring, here are some things that I've changed because of this project. I assumed prior, I assumed because you had a statistics review, you worked through the book in the master's program, that you would remember that. That was a wrong assumption. Okay, so you will be required to review the chapters in the statistics book, just like you did at the master's program. You're going to be required to do that. It's going to be broken down into small parts so that each week you have a review of what you have learned in the past, but you're going to have to review it and pass the quizzes. Is that intrinsic or extrinsic or germane? Breaking it down week by week where you have to get through it. What do you think? Well, it is germane because it applies to you, but it's managing the complexity. So it's both, really, isn't it? Good job. So if I tell you, it doesn't matter what kind of textbook you get. You can get a digital textbook or you can get a textbook in print. And 2 chapters are due in week 1, and for some reason you can't get the textbook. What does that do in terms of cognitive load theory? Is it extrinsic, intrinsic, or germane? Extrinsic, right? So as the teacher, I've got to make sure that that's available to you or that there's some alternative way to get it. Okay, if I give examples each week that show how that particular concept, or we'll say module, each module, how the concepts that you studied in that module pertain to you as a DNP clinician, what is that in cognitive load? If I show you give you examples of how it pertains to your work as a DNP, I'd say that's germane, probably germane. So it's really not rocket science to think about how theory applies. And we've been applying theory clinically, whether we really recognize it or not. Where's Olivia? There's Olivia. So Olivia is a pediatric nurse practitioner who sees kids, and how often would you say you see a kid with asthma come into the ED? Okay, every shift she works. So we know from theoretically based interventions that when Olivia sees that child and the teaching that she does with that child about how to use the inhaler, how to recognize prodromal symptoms so that you recognize what those are early before you have an asthma attack, and that's practiced at home with an adult, we can reduce the chance of recidivism, right? That's theory. Educational theory has guided how we do that. So theory guides our clinical practice, but you're going to be leaders and educators. Theory needs to guide how we teach. So this is an example of how we are struggling to make sure that what we do is theoretically guided. Theory enables us to move from our sacred cows. We've always done it that way. It's worked in the past, right? And our assumptions about what students know and how things work to an evidence-based approach to teaching, not only in clinical care, but in the classroom. And it provides a reproducible framework for improvement. And so in your graduate program here at LCU as a DNP, we're not messing around. You're going to do it. So in the class that you have with me, and we'll just start with my class. You're going to do an IRR. You're going to do a structured literature search that has an endpoint, ends in a poster. Some of you have done that at the master's, but at a higher level, and that's theoretically guided so that you can spring to your next semesters with a really solid structure with some pillars under it. It won't be done, but it's started at that point. And you will have reviewed your statistics, so you're not quite ready for it, but as you're assimilating other course materials, you're going to be building on that. And so, again, there's methodology behind it, and for many of you, we sometimes wonder, we think, why is this teacher torturing me? Why? Why, oh why are they making me do these things? But I would say our teaching team, for all of us, we are serious about teaching, not just our subject matter. And so we want our teaching to reflect evidence that suggests this is a good way for an online student to acquire or assimilate this information. And I think we hope to get this published. I think we're going to be breaking some ground if we can get it in the literature, because there's the need, as you saw from what Dr. Bolyard and Garcia said. It's kind of a mess out there, truthfully. There's no consistency in how this is taught. So we will be, hopefully get this in the literature, and LCU will be able to share some of what we're uncovering, and many of you, we expect you to be sharing both on the national and international stage, the posters that you develop, and then of course your projects, which will have we hope, a high and consistent degree of rigor. That's our intention. We may not do it perfectly, but that's our heart, isn't it? For you to not only graduate with the letters, but that you have the self-efficacy to know that what you did is valid and it's of appropriate rigor and robustness, that it could be, really used and implemented somewhere. So with all that in mind, team, come on up. What questions do you have for this team? We've got 5-6 minutes before we go eat a hamburger. What questions or comments for any of us? Ask the hard ones to Dr. Stennett.
Questions?
It was that good, right?
Yeah.
Riveting, right, riveting.
I hope this got given you guys
There's one.
understood.
I told you not to do that.
That's why I'm here. So, what are your next steps? Are you going to implement research as you are implementing this theoretical framework while you're teaching? Do you anticipate?
I'll start and then you can finish. I think the first step is we want to get this published to say we think this is the way to do that. The next step is Dr. Long is already implementing cognitive load practices into her courses. The unfortunate thing is we may not have pre-data. If we'd have thought about it, I'd have told you not to do anything yet. So we won't have pre-data for comparisons. So I don't know. It'll be a challenge to figure out how to show improvement. And I'm not sure how we'll do that. But I think that's the next step is this theory valid to do what we want it to do in these types of courses? And I mean, there's enough data out there about cognitive load that it works. I don't doubt that it's going to work. What I would like to be able is to measure how successful that work is.